The term dietary fibre applies to a group of non-digestible elements that are not absorbed by the human body after eating. Insoluble fibre passes through the digestive tract unaltered, and soluble fibre can be fermented by intestinal microbes and broken down to short-chain fatty acids. Insoluble fibre is found in whole grains, wheat, nuts and seeds. Soluble fibre is found in vegetables, fruits, legumes, oats, barley, and the main type of fibre in fibre-based laxatives. Numerous studies that observe cohort data over time have linked increased dietary fibre with a reduced risk of atherosclerosis, stroke, and peripheral vascular disease. In 2013, a review of 22 such studies spanning 2 decades and 3 continents found a significantly lower risk of atherosclerosis with a greater intake of insoluble, cereal, fruit, and vegetable fibre. The risk was lower with the soluble fibre as well, but the association was not statistically significant. Randomized control studies involving fibre have focused mostly on the cardiovascular disease risk. For example, a 2016 study randomized 60 post-menopausal women with elevated LDL cholesterol to receive brown rice extract supplements or placebo. At 6 months of treatment, those who were receiving the supplements had significantly lower levels of LDL cholesterol and TNF-alpha, a pro-inflammatory biomolecule. Moreover, the rice bran extract also improved the flow-mediated dilation, which is a measure of the vascular endothelial function. Polyphenols are naturally occurring compounds found in tea, vegetables, fruits and wine, and they're thought to counteract atherosclerosis by decreasing the LDL oxidation, promoting the nitric oxide levels, and inhibiting blood clot formation by reducing platelet clumping. In addition to being a source of monounsaturated fats, olive oil also contains polyphenols. A recent study examined the role of polyphenols in the protective effect of olive oil by providing the participants with either olive oil enriched with its own polyphenols or regular olive oil. A small sample of individuals with mildly elevated blood pressure were given a single dose of either boosted or plain olive oil in the randomized blind fashion. Those who received the boosted supplement saw an almost immediate improvement in their endothelial function. Flavonols are another type of polyphenol and are found in fruits, vegetables, green tea and cocoa. A major flavonol found in green tea and cocoa is catechin, and this is thought to have direct anti-inflammatory effect on the vascular endothelial cells. In a small trial involving patients with heart failure, eating flavanol-rich chocolate led to an almost immediate improvement in the vascular endothelial function when compared with plain chocolate, and sustained improvement after 4 weeks of daily consumption. Similarly, when 30 overweight men and women were given dark chocolate with a sugar-free cocoa beverage, the vascular endothelial function improved compared to those who were given a low flavanol chocolate bar and a cocoa-free beverage. The women in the study also saw an improvement in arterial stiffness with the administration of dark chocolate and cocoa. This effect might also extend to black tea, as this contains polyphenols, thiorubenins, and flavonoids. In a 2015 study, participants with high blood pressure drank a hot beverage containing a controlled amount of black tea-derived polyphenols, and the researchers found the polyphenol beverage dose-dependently improved the blood pressure and the arterial stiffness. Picogenol is obtained from the French maritime pine tree. Between 2/3 and 3/4 of the picogenol is made up of catechins and their chemical cousins epicatechins. Picogenol benefits the cardiovascular health through a variety of mechanisms. It's been demonstrated to inhibit the inflammation and the clotting and to improve endothelial function. In a randomized placebo-controlled trial, individuals with atherosclerosis received 200 mg of picogenol every day for 8 weeks, followed by a placebo or vice versa. Treatment with the picogenol resulted in a significant reduction in oxidative stress and a 32% increase in a standardized measure of blood flow and vasodilation, a powerful indicator of endothelial function. Quercetin is a polyphenol and it's found in apples, onions, cherries, and grapes. It's known to possess anti-inflammatory and antioxidant properties, as well as a beneficial effect on diabetes and obesity. A controlled trial that tested quercetin supplements in 37 individuals with elevated blood pressure found improved measures of inflammation linked to atherosclerosis as compared to a placebo. Resveratrol is another polyphenol and it's found in grapes, berries, and peanuts. Historical studies suggest it has a positive treatment effect on atherosclerosis and high blood pressure. It may inhibit the formation of foam cells and inhibit the uptake of oxidized LDL. One animal study found that in mice who were fed a cholesterol-rich diet with and without resveratrol for 2 weeks, the mice who were given the resveratrol had atherosclerotic plaque regression and decreased plasma cholesterol levels. A study randomized 50 diabetic patients to receive either supplemental resveratrol or a placebo for 12 weeks, and it then measured a number of physiological and metabolic parameters and compared them to the parameters determined at the baseline. The study concluded the resveratrol not only improved the blood pressure and the body weight, but it also reduced arterial stiffness, a common surrogate for atherosclerosis. Hesperidin is a polyphenol and occurs in citrus fruit, especially the peel. Digestion of hesperidin produces compounds called hesperitin, along with other metabolites. And these compounds are powerful free radical scavengers, and they've demonstrated anti-inflammatory, insulin-sensitizing, and lipid-lowering activity. In a randomized, placebo-controlled crossover trial, 24 adults with metabolic syndrome were treated with 500 milligrams of hesperidin per day or placebo for 3 weeks. The hesperidin treatment improved the endothelial function, suggesting it might be an important mechanism behind its cardiovascular benefits. The hesperidin supplementation also led to a 32% reduction in C-reactive protein, as well as a significant decrease in the level of total cholesterol, apolipoprotein B, and a marker of vascular inflammation relative to a placebo. Hydroxytyrazole is the main phenol found in olive oil. It's a potent antioxidant and anti-inflammatory agent, and it might inhibit the LDL oxidation, platelet aggregation, and atherosclerosis progression. In one randomized crossover trial with 200 healthy males, the participants received 25 milliliters of 3 olive oils, one with a 2.7 mg per kg phenolic compound, one with 164 mg per kg, and one with 366 mg per kg, for 3 weeks, followed by a 2-week washout period between the treatments. The HDL good cholesterol levels increased, and the triglyceride levels decreased in all groups, and the oxidative stress markers decreased linearly depending on the phenolic content of the oil. The researchers concluded the benefits of olive oil were greater than its monounsaturated fatty acid content, and the phenolic compound in the oil might benefit the plasma lipid levels and help to prevent the oxidative damage. In another randomized, double-blind crossover study with 13 early-stage hypertensive patients, the subjects received 30 milligrams of functional olive oil that was enriched with its own polyphenols, or standard virgin olive oil. The markers of endothelial function were followed for 5 hours after the oil consumption, and the enriched oil demonstrated a greater benefit than the standard oil. Phytosterols are plant compounds and are similar in nature to cholesterol. They help support healthy LDL levels by competing with the cholesterol for the uptake into the cells. As previously highlighted, cholesterol plays a role in the development of cardiovascular disease and atherosclerosis, and the phytosterols can be found in rice bran, wheat germ, corn oil, soybean, and peanuts. In a randomized, double-blind, placebo-controlled trial, 232 men and women with elevated cholesterol levels consumed 20 grams per day of a low-fat spread with or without plant sterols for 3 months. The serum LDL levels were reduced with the phytosterol supplementation. In a meta-analysis of 20 randomized controlled trials with over 1,300 subjects, there was a clear association between the phytosterol intake and reduce serum LDL cholesterol levels. In an older cross-sectional study of over 22,000 men and women, aged 39 to 79, the researchers concluded a high intake of plant sterols was associated with low total and LDL cholesterol levels. Beta-cysterol is a plant sterol, and it's associated with healthy cholesterol levels and optimal cardiovascular health. It's also believed to combat obesity-related inflammation, and it might help to treat metabolic disease. Research in hypertensive rats with renal damage suggests the treatment with beta-cysterol for 2 weeks decreased the atherosclerotic markers, including the total cholesterol, LDL, and triglyceride levels. The family of B vitamins includes 8 compounds: thiamine, riboflavin, niacin, pantothenic acid, pyridoxine, biotin, folate, and cobalamin, and they play a role in energy production and cellular health. And they're found in fish, leafy green vegetables, and liver. Data suggests the B vitamins play a role in maintaining the optimal cardiovascular health. In a randomized controlled study with over 300 people, the subjects with the highest intake of a variety of micronutrients, including vitamin B6, folate, and antioxidants, had the lowest risk of stroke and cerebral atherosclerosis. In another trial involving 81 people with mild to moderate high blood pressure who were not on blood pressure medication, a combination of L-arginine at 2.4 grams per day with B6, folic acid, and B12 improved the vascular function, including blood pressure, endothelial health, and homocysteine level compared to placebo. Niacin, or vitamin B3, is involved in energy production and cellular communication, and it's found in poultry, meat, and fish. Research has long suggested that niacin plays a role in maintaining the cardiovascular health, including decreasing coronary artery disease and stroke. Animal research suggests the niacin inhibits the atherosclerosis and decreases the levels of inflammatory cytokines. A randomized placebo-controlled study with over 300 patients with coronary heart disease with LDL cholesterol levels less than 100 mg per deciliter and HDL cholesterol levels less than 50 mg per deciliter who are on statins found 2,000 mg per day of niacin was more effective than 10 mg per day of azathioprine at reducing the carotid thickness after 14 months. Vitamin C is a potent antioxidant, and it's a water-soluble vitamin, and it helps to synthesize collagen, metabolize protein, and to heal wounds. It's found naturally in broccoli and oranges. Vitamin E is a fat-soluble vitamin found naturally in nuts, seeds, and vegetable oils. It's a potent antioxidant, and it plays a role in the immune function and cell signaling. Vitamin E is actually a family of 8 different compounds, including 4 tocopherols and 4 tocotrienols, and research suggests it might be cardioprotective and exert control over atherosclerotic processes via microRNA regulation. Older cellular and animal models demonstrate that vitamin C improves the endothelial function. A population-based prospective study involved over 20,000 people, and it suggests vitamin C concentrations are associated with a decreased risk of stroke. In an older trial, 520 men and post-menopausal women, including smokers and non-smokers, took 136 international units of vitamin E and 250 milligrams of slow-release vitamin C. At a 3-year follow-up, the supplementation slowed the progression of the atherosclerosis in the men, and at the 6-year follow-up, a similar result was seen in both genders. While clinical trials involving vitamin E's cardioprotective ability have been mixed, some scientists believe this is the result of the type of tocopherol compound being studied, particularly the lack of gamma tocopherol, which has a potent antioxidant and anti-inflammatory effect. Vitamin K is a fat-soluble family of vitamin compounds, and it plays a role in blood clotting and bone metabolism. Vitamin K1 is naturally found in green leafy vegetables, while K2 is mainly found in fermented foods like cheese and natto. Importantly, adequate vitamin K is critical for helping to maintain the healthy calcium balance in the arteries and the bones. In fact, Older anticoagulant drugs, such as warfarin, block the activity of vitamin K, and these are associated with increased vascular calcification. Conversely, vitamin K supplementation, especially K2, slows the progression of coronary arterial calcification in people with pre-existing coronary calcification and helps to improve the vascular stiffness. In a study of 42 people with chronic kidney disease, the participants took either 10 micrograms cholecalciferol vitamin D3 or a combination of 90 micrograms miniquinone vitamin K2 and 10 micrograms cholecalciferol D3 for 270 days. The group taking the vitamin K plus the vitamin D showed lower carotid arterial stiffness, suggesting the combination slowed the progression of the atherosclerosis. In a randomized control trial published in 2015, supplementation with 180 micrograms of miniquinone 7, the MK7 form of K2, was compared to a placebo in 244 healthy postmenopausal women. After 3 years of the women taking the MK7, it showed decreased arterial stiffness compared to the placebo. Similar results were obtained in a smaller single-arm trial among renal transplant recipients who were taking 360 micrograms of the MK7 every day for 8 weeks. A 2020 meta-analysis of 3 cohort studies analysed the association of vitamin K1 concentrations with cardiovascular disease and mortality from any cause. The results from 3,891 participants indicated while there was no significant difference in cardiovascular disease risk with the K1 levels, the risk of all-cause mortality was 19% higher in those with the lowest circulating K1 levels. CoQ10 is a naturally occurring antioxidant, and it plays an important role in cellular energy metabolism. Statin therapy significantly lowers blood CoQ10 levels, and for this reason many healthcare providers recommend CoQ10 supplementation for people taking statins. A CoQ10 deficiency is associated with an increased risk of cardiovascular disease. Several publications suggest that CoQ10 has beneficial effects on C-reactive protein and levels of pro-inflammatory biochemicals. After 1 year of supplementing with CoQ10 and aged garlic extract, a small trial of healthy, non-smoking firefighters found an improvement in measures of arterial stiffness and endothelial function compared to a placebo. In the same group, calcium artery scores were used to estimate the risk of atherosclerosis before the treatment. The average calcium score was in the moderate range. Supplementation slowed the rate of the increase of the average calcium score by a statistically significant amount, suggesting the combination of CoQ10 and aged garlic extract can slow the progression of atherosclerosis before it becomes clinically evident. A review of 5 control studies established that the CoQ10 supplementation improved the vascular endothelial function in the patients with known atherosclerosis or significant risk factors for atherosclerosis, like high cholesterol and diabetes. Macrophages isolated from the blood of healthy volunteers that were given 100 milligrams of CoQ10 for 1 week proved resistance to foam cell formation compared with those from the people who received the placebo through increased cholesterol removal from the cells. A recent cellular study found that CoQ10 might play a role in reducing the atherosclerotic plaque by inhibiting a platelet signaling pathway. Magnesium plays several important roles in cardiovascular health. Accordingly, magnesium deficiency can contribute to several problems with cardiovascular physiology. Clinical studies have shown that magnesium supplementation can favorably modulate parameters that are related to cardiovascular health, including blood pressure, endothelial function, arterial stiffness and calcification, and the HS C-reactive protein levels, among others. Observational evidence suggests greater magnesium intake is associated with lower mortality among the people who are at risk of cardiovascular disease. Propanol L-Carnitine has received attention for its ability to decrease the severity of atherosclerotic lesions in animals. The propanol L-Carnitine is a chemical made in the body, and it rapidly passes into the cells across the mitochondrial membrane to supply free carnitine, a much needed factor for energy production. Carnitines are essential for mitochondrial fatty acid transport and energy production, which is important because endothelial cells and heart muscle cells mostly burn fatty acids as their source of energy. Animal studies suggest Propanol L-Carnitine can help to prevent or decrease the severity of vascular disease. In rabbits who are fed a high cholesterol diet, which normally induces endothelial dysfunction and subsequent atherosclerosis, supplementation with Propanol L-Carnitine results in reduced plaque thickness, markedly lower triglyceride levels, and reduced proliferation of foam cells. In a rat study, Propanol L-Carnitine accelerated wound healing, reduced oxidative stress, and it improved vascular function. In human studies, Propanol L-Carnitine produced significant improvements in maximum walking distance in those with claudication. Carnosine is an antioxidant, and it naturally occurs in meat sources, and therefore it's often lacking from a vegetarian diet. Carnosine is a dipeptide, which has two amino acids linked together. It's composed of the amino acid L-histidine and beta-alanine. In the body, the carnosine can counteract oxidative stress and improve muscle contractions. In the lab, when added to cultures of human macrophages, the carnosine inhibited the formation of foam cells. Animal research suggests the antioxidant and anti-inflammatory and chelating properties of the carnosine make it potentially therapeutic for cardiovascular and metabolic disorders. A pilot study in overweight individuals demonstrated improved insulin resistance after 3 months of carnosine supplementation, leading some experts to hypothesize that the carnosine may prove to be useful in controlling the atherosclerosis risk factors, particularly in diabetes. For more on atherosclerosis, herbs, supplements, and natural treatment plans, check out my website.